All right, what happens when you hit that point where you're like, something's wrong, I think I need help, I think I need to talk to somebody about this? Okay, so let me walk you through the steps of my experience, and I would imagine it's pretty standard, and this is something that I've done a few times, not just because I have two separate diagnoses, but because of the nature of depression and anxiety. The phrase I've heard people use is, with mental illness, you're never really out of the woods. So there have been times where I've been fine for a long time, and then it starts to come back and you need a re-diagnosis. So I'm going to walk you through what I experienced and sort of generally what to expect from the process. Now, first off, you can go see anybody you think might be helpful. So you can go to a mental health professional, you can go to a medical doctor, and either way they will be able to help. What I would recommend is actually starting with a doctor, because in order to get a diagnosis, this is a medical condition, you will need a doctor to issue that official diagnosis. If you decide to go the route of using medication, you also need a doctor to prescribe the medication. Now, if you go instead to a mental health professional, depending who they are, they may say to you, I suspect this is what's going on. And they may say, you should go see your doctor, or refer you to someone they know, depending on your situation, if you have a family doctor or not. But they will not be able to issue a diagnosis. The exception is a psychiatrist. Psychiatrists are also medical doctors. They have been to med school. They are the crossover. But if you're seeing a psychologist, a psychotherapist, a social worker, they can all provide the therapy piece, but they cannot give you a diagnosis. When it comes to getting sort of that therapy treatment, you also need to think, of course, about insurance. That stuff is not covered by universal healthcare, where a doctor is, and a psychiatrist may not be either, depending where you are and what that looks like. But you go to see your family doctor, you go to a walk-in clinic, that person, that's covered. And so you don't have to worry about paying extra for things. The other thing to bear in mind here is, So how do they actually diagnose you? I will link to a couple of different screening tools that are used for this, so you can actually go check them out. They were both on the website for the Canadian Association for Mental Health. Depression is diagnosed with something called the PHQ-9. That's it. This is what it looks like. This is one page. It's not a very long screening tool at all. The PHQ-9 is the one I've done the most. I've had this a few times, and I've actually noticed over the years that the questions have changed slightly, but it still covers the same stuff. So what they do, there are 9 questions on here. That's all they ask you. It does not take very long at all. And they'll have you rate on sort of a Likert scale of, that's not at all been an issue to me, several days in the last 2 weeks, that's been an issue to me, more than half the days that's been an issue to me, or nearly every day that's been an issue to me. And so they go through, so it's stuff like little interest or pleasure in doing things, feeling tired or having little energy, poor appetite or overeating, trouble concentrating, moving or speaking so slowly that people have noticed, or on the other side, being really fidgety or restless, thoughts that you would be better off dead or of hurting yourself in some way. And so what they do is you say, that's not at all been me, all the way up to, actually, that's been me pretty much every day of the last 2 weeks. And they do base it on the last 2 weeks. And based on that, they will score whether or not you are in a category of nothing at all, mild, moderate, or severe. Those are the options. You're totally fine. We'll maybe put a watch on things, but you don't pass the screening or fail the screening, depending on your perspective, or all the way up to, this is a severe situation. If it's anxiety, they have a slightly shorter scale. So this is 7 questions. It's called the GAD-7, which stands for Generalized Anxiety Disorder. Very, very originally named. The other one is PHQ, Patient Health Questionnaire. I guess you don't need to be adventurous. You just need to be direct. Okay, so this is 7 questions. Over the last 2 weeks, how often have you been bothered by any of the following problems? And it's the same scale. Not at all. It's been several days. it's been more than half the days, or it's been pretty much every day. And some of the things they ask: feeling nervous, anxious, or on edge, worrying too much, not being able to stop or control worrying, becoming easily annoyed or irritable, feeling afraid as if something awful might happen, so that catastrophe. And again, based on that, now with, this is pulled all from, by the way, I forget how it's the DSM-5. I think now we're at version 5, and I forget what that stands for. Disorders and mental disorders. Just somebody, I'm sure, will comment or email me and be like, dude, it's this, come on. Get it together. So that's where this comes from. In terms of anxiety, the levels are mild, moderate, severe, or extreme. So we get a whole other level of severity when we're looking at anxiety over depression, but that's it. They use whichever screening tool they think they need to use. They might do both if they think you're experiencing symptoms of both anxiety and depression. And based on how you rate on these scales, they will tell you whether or not you have anxiety or depression and at what level of severity it is. Once you get that diagnosis, I know what happened with me. Doctors immediately referred me to counseling. Either someone they knew, or if it was like, I've been in medical situations where it's like a clinic, it's like a community of practice. So they were like, oh, we have counseling services right here. So they work together, which is actually sort of nice because within the frame of confidentiality, they were still able to share parent and patient, information. So that was actually really nice that they could do that, because it was a lot of shortcuts. You know, I didn't have to go back to the doctor and explain what has been happening at therapy and is it working? And I didn't have to go to the therapist and say, this is what's going on with the doctor. They were talking amongst each other, which was actually sort of nice for me. In other situations, it's been a matter of the doctor has a few different therapists that they know, that they recommend, that they work with. And so I was directly referred to a particular person. What I will say is there is a good potential, if you are in severe or extreme territory, based on the doctor's judgment, it would not be unheard of for them to hospitalize you. The other thing I will say is if you are feeling very, very extreme stuff, we've talked about symptoms. I read out some of the questions to you, and you can go check it out. If you think you might be teetering on that very, very hard edge, go to the emergency department at your nearest hospital. That is 100% a medical emergency, and they should treat it as such. Hospitals have gotten better at that. They may or may not be as good as you want them to be, but they have gotten better, particularly in light of the COVID pandemic. We also have the new 988 number in Canada, the mental health emergency line. You can call that as well. And yeah, if you're not sure, that might be this is how I'm feeling. Should I go to the hospital? And they will let you know. And my guess is if I was going to train people for that every time, I would say, yes, go to the hospital. But that is a medical emergency. And the thing I find with mental health is we don't treat it like it's medical, but it is. And so it's important to look at it that way and to treat it that way for yourself and for your friends and family as well. So that's really what to expect from the diagnosis process. It's not, you don't go for a lot of tests and stuff, right? It's not physical. They may send you for blood tests. I've certainly gotten that because there are physiological things that can contribute. And that is definitely an area I will touch on in terms of coping mechanisms as well. But yeah, they may actually send you for blood testing and test things like your iron levels and your vitamin D levels and those kinds of things. Essentially, it's a pretty quick process. It's a pretty actually standard doctor's appointment, a 10-15 minute doctor's appointment, unless it is an emergency situation, in which case there will be additional steps to mitigate the process for you. That's what to expect. See you next time.